I'm going to explain two contrasting scenarios of the patients who came to me with back pain. I'm using their MRI to make you understand how the disc pathology can affect varied population at different points in their life, and how some disc pathology progresses very slowly and some pathology progresses very rapidly. The first MRI belongs to a 65-year-old female. She was working as a principal in a college, and almost half of her life, like since 30 years of her life, she was having chronic episodic low back pain and with intermittent sciatica episodes. She had sitting intolerance. She could not get up in the morning due to back stiffness. Any household activity will make her back pain worse. Every now and then she goes to a doctor, gets some treatment, changes the physio, changes the doctor, and somehow she was managing, but not pain free. She was learning to live with the pain. And then she met me few years back, and that's when we realized that she was having discogenic low back pain. Until then, she didn't know that it was a disc problem. She thought it's a back strain and then muscle stiffness or tightness, and she was trying to do various forms of exercise like yoga and stretching, vitamin D, calcium, B12 supplements. You know, right? People tend to do all sorts of things except doing the diagnosis. And then we realized after seeing the MRI that she was having chronic disc degeneration with L4, L5 disc herniation. At the same time, she is also having L3, L4 disc bulge and L5S1 degeneration. So this patient was having chronic discogenic low back pain, which was hampering her life for the past 30 years. And nobody could diagnose that it is coming from the disc, and nobody told that it's a sciatica type of symptoms. At present, she is fairly painless because she is retired. Her life is very lighter now. There is no much physical load. She doesn't have to sit for a long time. So she is kind of relaxing and then doing our exercise what we told her. So she is relatively painless now. But if somebody had addressed the problem pretty early in her life, she shall not have to suffer with this kind of pain for that many years. This is one category of the back pain where it starts very early in the life, but it does not rapidly progress that it needs a surgery. But the bulge or herniation will be constantly causing them the pain, episodic pain, periodic pain, flare-ups, and then it will undergo remission for a few months or sometimes years. Again it will flare up. So this is how some patterns of back pains are. The second scenario is a 28-year-old female. She met me with acute onset of back pain. Earlier she had one more episode a month back which got better with medicines, but again due to some prolonged sitting related work she got her back pain worse, and this time the back pain is not only staying as back pain, it became a serious sciatica pain which was traveling all the way down to her right leg and then going to the calf muscles. This patient, though she is very young, she had severe back pain and sciatica and she was not responding to our therapy. So we ordered an MRI for her. She did the MRI and the MRI reveals this. She is having severe disc herniation. In fact, there is an extrusion of the disc material with inferior migration of the disc at the L4, L5 level. At the same time, she is also having some forms of modic changes in the L4 vertebral body in the inferior aspect. I always want to ask the question why? Why people get back pain, why people get disc herniation, why people get disc degeneration, and that too for her, why such a young age she has to have this kind of herniation, whereas in the previous example that 60-year-old lady, she was having back pain but her MRI is not as severe as this young girl's MRI. This patient is a software engineer. She is always sitting in her office for about 10 to 12 hours. That she was doing for the past 5 to 6 years, but apart from that she never got hurt, she never fell down, she never did any weightlifting. There is no major other predisposing factors which I could agree that would be the contributing factor. When the disc is extruded and if it is inferiorly migrating, it will be very difficult for the physio to correct it in short period of time. It needs time. This patient was also developing some form of calf weakness, so we recommended her to get a surgical opinion. She is taking some forms of medication and she is currently under rest. The decision of surgery is withheld as of now. Gone all those days that we thought the disc herniation or the disc pathology happens to only old people. Nowadays there are so many other variables are playing a role here to make the young people suffer with disc degeneration. A 28-year-old with a severe disc extrusion like this is completely unacceptable. The factors that contribute to the disc degeneration and disc herniation are the age, If when you are old, you tend to get more of disc degeneration. And then the gender, female tend to have more risk of degeneration than the male. Thirdly, it could be a trauma. You might have fall from height, or you could have got some injuries in the sports that would trigger the process of degeneration. Or it could be a repetitive constant static loading that happens for the software engineers who are sitting for many hours. They are the one who get constant static repetitive loading on the lumbar spine. That would be one of the major contributing factors for disc herniation. And finally, we need to talk about genetic phenotyping. The disc pathology runs in the families. How healthy the disc would be is determined by your genetic makeup, your cellular turnover, your neuroimmunoinflammatory response to any given injury, and your enzymatic reactions to a cellular turnover. All will decide how healthy your disc could be or how fast your disc will degenerate. So people who are having such kind of genetic or the cellular type, they are the one who suffer disc degeneration very early in their life, and we will never know who are that body type unless they become a patient, because nobody randomly does an MRI, isn't it? But it can be reasonably confirmed that when very young people without any risk factor, if they have a disc degeneration and disc herniation, we can attribute that towards their genetic makeup. Such people have to be very careful in their future, because these people have future risk of getting back pain. Even if they undergo surgery, there is a risk of reherniating to their disc. So when it comes to discogenic back pain, it's all about individual variation. So every individual is different.